My research program in general is about how nurses make decisions, and so that has led me to look at a number of different aspects of work that nurses do. I've done some looking at nurses' receipt of influenza vaccination. I've looked at nurses' work around discharge planning, and I've done some work around end-of-life care. I've also done some work with patients and their decision making, and I think all of our research has some minor impact, but I would say that some of the work we've done with end-of-life care has had an impact on clinical practice in terms of helping people to understand a little bit more about what our patients experience at end of life. And some of our work around discharge planning has helped us to make some improvements in discharge planning. Research work is really fun for me, partly because it's really collaborative work, and so there's opportunity to work every day with really diverse people, both colleagues and the patients and the nurses that I study. And the other thing is the impact of understanding how nurses and others in healthcare think about their work and what they do is really fun, and it is really rewarding. Even though research, you get those rewards very slowly and incrementally, it's really nice to be able to see that your work is valued and used. My current research collaborations are we're doing a study in the ICU, extending some of my dissertation work around surveillance as a nursing intervention. So I'm working with some of the critical care leadership team to explore that in a critical care setting. I'm also doing some collaboration with faculty both here at Mayo and at the University of Minnesota around nurses' experiences with end-of-life decisions. And then I also have some collaborations around a project with end-of-life care, advanced care planning. Been able to collaborate with a number of nurse researchers, staff nurses, as well as some of our physician colleagues. Most notably, Dr. Andrea Cheville. We did a study that was very well received on patients' experiences around exercise as an intervention in advanced lung cancer. So that was a really exciting collaborative experience. I did some work with Dr. Mike Wilson and Dr. Anjan Guys about decision making with withdrawal of life support. So building those collaborations and being able to work on some of those things. We've done some work as well with Dr. Poland around nurses' value of influenza vaccination. So really exciting to be able to work with both nurse and other colleagues. You know, we have a number of projects just underway, so I think it's really a matter of kind of getting some of our studies done and published and really figuring out what's the next step and how do we take it to another higher level. I hope that we'll see some publications that emphasize nurses' decision making and how we can inform what we do in terms of teaching and preparing nurses in the clinical setting.